And we return back in here on 1480 WHBC, as you can view us now not only on the Facebook feed, but also on our Twitter feed as well at 1480 WHBC, as we are discussing the latest on COVID with Dr. Panagis Galiatsatos from the Johns Hopkins School of Medicine. Dr. Galiatsatos, how are you this morning, sir?
I am well, and an honor to be back.
Well, it's great to have you on the show. And as I mentioned to you, a couple of different things I want to get to. Obviously, the Israeli study on fighting off COVID and the different ways that there are kind of therapeutics that are being introduced at this time. I know this is a really interesting topic of discussion because we've been looking for these for a while. What do we know now that was maybe different from before?
So a couple things. I mean, by all means, I mean, there's three ways this pandemic ends. A massive compliance of the hygienic interventions, 95% or more. That's how we stopped two other coronaviruses in 2003 and 2013. That's hard to come by. And a lot of it is just because of the insidiousness of the virus and the asymptomatic spread. The other one is a vaccine, which is great. We have two, with a third one might be approved as of today for emergency use. But the other third component, and this is key, is can we find a cure, right? The analogy here is like you have antibiotics for bacteria. We don't have thousands of vaccines for bacteria. We don't really need to. We have great antibiotics that work for the majority of bacteria that are around. So could we get an outcome like that for SARS-CoV-2? This is really hard. Fighting viruses is not the same as fighting bacteria. Bacteria rely on themselves. They make more of themselves. They destroy tissue. Viruses invade our cells, right? So it's hard to do that. It's like trying to catch a burglar once they get into a house. It's just much easier to catch them when they're outside of the house. So I'm excited about the Israeli studies. I think, I always hold my breath. I need to see more of it. I say this because all these COVID-19 studies get done a little bit differently depending on the country they're in. And that difference results in a lot of just confusion. Like it worked in them and didn't work for us. And why is that the case? So I'm optimistic. We've learned a lot. At the same time, we just know that SARS-CoV-2, just like a lot of other viruses, it's just hard to find a true antiviral to lead to cure. That, while we want that, I will say even if we do studies and it fails, it's another lesson to learn to move on to the next one and to the next one. So more to come.
I know that the one thing when reading about it that was maybe a little bit over my head from a medical standpoint was reading about the cytokine storm. And I know for a lot of people, they're in the same boat as me where they hear that and their eyes kind of glaze over. And I guess I would ask, why is that important when fighting off COVID?
Yeah, so, our immune systems, when they work, right, to me, like the analogy I'm going to give you is it's like a well-orchestrated symphony. It's in harmony. You'll feel bad. You'll get some fevers. A lot of that is, raising the body temperature is kind of a evolutionary trait that hasn't left a lot of animals. Makes you feel ill, so you stay isolated and therefore hopefully not spread. But raising it helps fight a lot of these infections. When the immune system is working in harmony, it's good. You might feel miserable, but you're home. It's not life-threatening. SARS-CoV-2 and many other infections do this, where some way, shape, or form, it's complicated in a sense of just like we all continue to try to understand this. Why for some people's immune system, that symphony is lost and it becomes more of a cacophony. Disorganized, massive release of immune systems. It is a bull in a china shop, right? And it'll destroy the virus, but it's going to destroy your organs and so forth. We've known this before SARS-CoV-2 with sepsis. Sepsis, a Greek word meaning flesh rotting, coined by Hippocrates, sepsi. But sepsis is that, right? It's just an aberrant immune response to an infection. SARS-CoV-2 does the same thing. So some of the best interventions for COVID-19 haven't really been to attack the virus. It's been to attack the cytokine storm. Can we calm it down? Can we mitigate it, right? So that's for instance, the steroid studies, dexamethasone, massive mortality benefit, survival, and it didn't really cure the virus. It just shut off this cacophony of an immune response. So these are great questions. The challenge we have with viruses is, can we come up with an antiviral to cure this? It's hard. But does it cause other consequences like this, the cytokine storm? And if it does, then we can come up with interventions to stop that. Stopping that massive inflammation can buy people life expectancy and survival.
Dr. Panagis Galiatsatos is my guest, not only on 1480 WHBC right now, but also our online video stream on Facebook, YouTube, and Twitter. Dr. Galiatsatos, I know that this is interesting to me, learning more about this, because when this first came along, we had no idea about how this would respond to the human body. Why does it take so long to learn these things, and why does it take so long to have answers to these things?
Yeah, no, some of it is the pace of science, and Mother Nature has a variety of ways of, has a lot of secrets, and it's just hard for us to unravel all of them. We're human beings. I know we just landed on Mars, but keep in mind, just studying an immune response to a virus is complex. I mean, there's so many variations and angles to pursue and questions to ask. I will say, though, it feels like a long time, maybe because in the pandemic, 1 year feels like 10 years. I get it. But please understand also the pace of science. I've never seen it work so efficiently to try to get us answers in real time. A lot of the answers we get tend to be more good hypotheses to pursue, and then we try them out. But we're doing our best, I promise you. Like, we are moving forward in a pace to try to get as many answers as possible. It's just battling a virus like SARS-CoV-2 is hard. It is one that, it's been a year, we've had some interventions, but the fact that we got a vaccine, that to me is one of the biggest benefits that we could have gotten. So we're getting to know a lot about the virus. We got a lot of good hypotheses. We're putting them to work to see if it helps. But what I would say is the pace of science, I know it feels slow because we went out of this pandemic, don't get me wrong, but I promise you, this is the most efficient and expedited science approaches that I've ever seen.
Now, I know the other piece of this that you and I were going to talk about this morning is the fact that we have the Moderna vaccine, we have the Pfizer vaccine. I know that AstraZeneca is being worked on too, but Johnson & Johnson, the one, and this is the single shot vaccine, isn't it, Dr. Galiatsatos? So where is this at with the FDA, and what can you tell us at this time?
Yeah, no, so I did my homework assignment. I try to do this for my patients in my community. So I printed out the FDA report that they're reviewing today. Sorry for the scribbles, those are my notes. But that's what the FDA is reviewing today for an emergency use. What I like, so Moderna and Pfizer, like, I applaud them. That technology, while it's new for the public, it's been well researched for the last 17 years. And they were, one of the first ones to introduce themselves for coronavirus vaccines because of SARS-CoV in 2003 and MERS-CoV in 2013. So it's probably one of the reasons why they were right out of the gate ready to go. Johnson & Johnson, also very efficient. Here's a few things that I like about reviewing the study. One is diversity, right? So Moderna and Pfizer, respectively, 10% African Americans, about 25% Hispanic Latinos for both studies. Johnson & Johnson, it's about close to 50% Hispanic Latinos and close to 20% African Americans. So the minority recruitment for this, I'm hoping, gives a lot of people peace of mind of saying, well, did it recruit people that look like me? I can say Johnson & Johnson did. And a lot of it has to do with the fact that the study happened in the US and a lot of Latin American countries. So, but this is important, right? You want to have an intervention that looks like the people who are being ravaged by this. And, every headline has emphasized this in medical reports. Minority populations are disproportionately impacted by this. And so I'm hoping the Johnson & Johnson vaccine provides a bit of peace of mind to that. And then what about its efficacy? Does it work? Yes, at 28-day survival, it looks like it provides us somewhere around 85%. The one part people are probably going to raise some concern over is when you break it down by age, 18 to 59, looks like it's 90%. 60 and older, where my parents fall, for instance, it's about 70%. So is there an age variant with this? We'll have to find out. I know Johnson & Johnson is also looking to see if there's a booster that they can give to kind of push those numbers to Moderna and Pfizer levels, because Moderna and Pfizer, for the older population, it's 100% effective. Wow. So these will be conversations we'll have to have about, do we consider one for younger and one for older? But the fact that we have 3 in our toolbox now, 2021 is looking to be more and more promising, where we can return to some resemblance of normalcy.
Well, that's what we like to hear. And Dr. Panagis Galiatsatos from the Johns Hopkins School of Medicine. Doctor, we appreciate the time this morning. I look forward to when we do this again. You Be safe, your family as well, and we'll do this again, okay?
You got it, my friend. Always happy to come back.
Sounds good. Thanks. There he is, Dr. Panagis Galiatsatos on 1480 WHBC. We'll take a break. When we return, we will be joined by Congressman Tim Ryan this morning on the show. Of course, a congressman from here in Ohio. So stay with us, and we'll have him on the show when we return.